Hello again and welcome to my YouTube channel. Again, we're going to discuss today continuation of the series on sleep, and we're going to be discussing about some of the possible major causes of sleep that you may be encountering in terms of sleep debt. So please watch and listen. Why can't I sleep? So for today, we're going to be discussing about what are some of the major reasons for sleepless nights. We all know that sleep debt is medically unhealthy. In fact, we have several side effects of sleep deprivation. In terms of health, it has been shown to significantly increase your risk of developing malignancies. 36% increase in your risk of colorectal cancer, nearly a threefold increased risk of developing diabetes, and what happens is there's a 3 times more likely for you to catch cold because you feel weak and tired, with a 48% increase in your risk of developing heart disease. What also is very important is that 50% of patients who are not sleeping properly will develop obesity or become overweight. Why? Because sleep debt results in your body to crave more sweet, salty, and starchy food. So what's very important is how do you determine if you are not sleeping enough? First, if you have difficulty sleeping on a regular basis, if you feel tired during the day, even if you think you slept 7 hours, or when you start waking up very early in the morning, or if your partner will complain that you've been snoring loudly in the past few days. And once you go back to work, you are struggling to pay attention at work meetings or during a class or training session. Or friends will start to tell you, I think the pandemic has made you sleepless because you look tired and has noticed some eye bags or dark circles around your eyes. It is therefore very important to prevent critical consequences of sleep debt that we should determine what are some of the causes of sleep debt. So why can't you sleep? Now, one of the major causes of sleep debt is actually stress. We know that chronic insomnia can usually result from a life event or a habit that has been shown to be disrupting your sleep, specifically because of a stressful situation, such as the death or illness of a loved one, personal reasons like divorce or job loss, and all of these problems can make your mind active at night and thereby making it difficult to sleep. One major undiagnosed reason for sleep debt is actually the development of a mental health disorder. And one major mental problem is anxiety. When you start to think too much over unresolved issues overnight, and this can disrupt your sleep. A very critical symptom that you're already developing an early sign of depression is when you're starting to awaken very early in the morning. Remember, if this will be an early form of depression, early diagnosis is key because anxiety and mental disorders, if untreated, can result in worse outcomes. It is therefore best to consult your doctor to get help over the mental issues with psychotherapy because they can easily be remedied with psychotherapy and medications. But one very important reversible cause of sleep debt, which you don't even know that you're doing, would be some of the poor sleep habits. If you have a regular bedtime schedule, you've been taking naps during the day, or prior to sleeping, you have the stimulating activities which we are guilty of, like watching TV or using computers or smartphones for work and games, or even shopping just before bed. This can interfere with your sleep cycle. It is best to put down these gadgets 1 to 2 hours before your bedtime schedule. Furthermore, part of the poor sleep habits would be, since we're sleeping late at night, we tend to eat. And sometimes when we eat too much late in the evening, it can be physically uncomfortable lying down because of what we call as heartburn. If you develop heartburn, this can actually disrupt your sleep and keep you awake. But one very common issue why you are not able to sleep well is aging. We know that sleep often becomes shorter and less restful as you age, as you can easily wake up even with small noise in the background. So disruption of sleep is very common. We also know that with age, there are some changes in your internal clock, meaning as your body ages and changes with age, so with your internal clock. So what happens is that you get tired earlier in the evening and then you wake up earlier in the morning. Furthermore, age can also hamper you physically and socially. So if you start to be physically and socially inactive, this lack of physical activity and social interaction can also affect your good night's sleep. It is very critical, therefore, that even if you are already aging, physical activity and exercise should be part of your lifestyle habit. But one very important medical condition that is almost always undiagnosed and undiscovered by a lot of patients and even doctors is the so-called obstructive sleep apnea. This is a condition where the patient has blocked airway when into deep sleep and starts snoring. Snoring, as complained by the partner, is a very common complaint or symptom of obstructive sleep apnea, and it really signifies partial airway obstruction. Accompanied with this snoring is the choking, coughing, and gasping for air. With obstructive sleep apnea, due to lack of oxygen, patients usually wake up gasping for air. There's an episode of apnea or no breathing, then coughing as if gasping for air. This is a stage where the patient starts to go into deep sleep, but obstruction of the airway occurs, and therefore they cough and disrupt sleep. What's important is this patient will have dry mouth because they breathe through the mouth because of the obstruction, so they complain of dry mouth and morning thirst. And because they were not able to sleep properly at night, which they thought they did, there's what we call as excessive daytime sleepiness. What does it mean? When they go to work, they go to meetings, you can see them nodding or sleeping while listening to a meeting. So most likely they were not able to have a good night's sleep due to obstructive sleep apnea. Now, what are some of the risk factors that will predispose a patient to develop obstructive sleep apnea? We see this a lot among our diabetic patients, hypertensive patients, especially those who are obese and overweight. So being obese and overweight puts this patient at high risk of obstructive sleep apnea. And majority of these obstructive sleep apnea patients remain undiagnosed. But it is very important that a wife or the husband informs the doctor that there is excessive snoring and episodes of shortness of breath at night or stopping of breathing, which can make this diagnosis early and therefore they can be remedied. Remember, Just like any conditions, obstructive sleep apnea, if left untreated, can lead to major complications like depression, heart disease, or arrhythmias, significantly due to poor oxygenation at night. There can be worsening of diabetes because of sleep debt. The body becomes stressed, and this will make the patient more insulin resistant and sometimes can even lead to high blood pressure and death. Another thing that you have to look into your armamentarium of medications is that you may be taking medications that make you not sleep well. Medications, for example, for asthma like theophylline, or for blood pressure medications like diuretics, can put you into sleep debt. However, most of these medications that can interfere with your sleep comes from your over-the-counter medications, specifically cough medications, because they can actually stimulate you overnight. However, without you realizing it, you may actually be taking caffeinated drinks like coffee or tea, and this caffeine or other stimulants may also be present specifically in your weight loss pills. These stimulants will also be present in most herbal coffee or tea that are marketed as weight loss medications. And without you realizing it, these medications or drinks disrupt your sleep. But what is also very important are some lifestyle disruptions. What do I mean by lifestyle disruptions? Because you are into a weight loss program, you are into intermittent fasting, there are some dietary changes that you want to do to lose weight. And therefore, after dinner, you're not allowing yourself to eat. But since you have work to do, you have to sleep late, you become hungry. But since you cannot eat after dinner, you tend to go to sleep hungry. So stress during the work, which can trigger the hormone ghrelin, which will spike your food craving at night. But since you're not allowing yourself to eat because you are into intermittent fasting, can also disrupt your sleep. But again, as I've mentioned, caffeine and alcohol are two stimulants wherein if you drink them in the late afternoon or evening can disrupt sleep. Alcohol, for example, may sometimes make you sleep, but they can prevent deeper stages of sleep and often causes awakening in the middle of the night. The nicotine also from smoking has also been shown to interfere with sleep. So far, from medical conditions to lifestyle changes, to lifestyle disruptions, to mental disorders have been discussed as more of the major causes of sleep debt, wherein we can actually do something about it. So the bottom line is, when we talk about sleep debt or bad sleeping habits, we have to remember that they can contribute to chronic health conditions, especially diabetes and heart disease. And therefore, identifying the cause of sleep loss is, for me, a very critical step to finding the cure or remedy for your sleep problem. And if this chronic sleep loss is already hard for you to function during the day, it is best that you seek consultation so that we can identify the cause of your sleep problem and how it can be treated. So for me, knowing why you can't sleep is important in finding the right remedy, the right relief for your sleep problem. By doing so, we can thereby prevent long-term health complications. So in my next video, I'm going to present to you some of my simple tips on how to get a good night's sleep, which may be of help to some of you who are into the problem of sleep debt. So if you like my videos, please try to click subscribe and notification bell to be notified for new videos. Again, I'd like to thank my subscribers for tuning in and hope you can continue to help in my advocacy of educating people, whether my patients or not, through this YouTube channel, please help subscribe to my YouTube channel. And if you have any questions, feel free to ask me in my in the message section of the YouTube video. Please try to help click on some of the links of my previous videos. And again, thank you very much for listening.